So thank you everyone for joining this live webinar today. We know everyone's really busy, so we appreciate you taking the time to attend. If you haven't already, there should be a question that popped up when you joined. If you can just answer that question, we're going to address that in just a few minutes, but you can answer that in the chat box, as Buki said, so you can go ahead and do that. That would be great. We appreciate it. First of all, let me introduce to you Anna Pagliano. She is if you don't already know her, a product operations manager with Centis living in the greater Chicago area. So she's been in the dental industry for 15 plus years. And in addition to that, the dental insurance industry for 5 plus years. So lots of good knowledge. She has great real world knowledge in dental processes across all areas of dental practices. Anna loves talking with people and sharing her insights into how to improve efficiency and drive growth. She's been spearheading some really amazing initiatives here at Zentis, and she's been a great asset to us since joining our team. We love having her here. She's a great colleague and a friend, so please welcome Anna.
Thank you so much, Cheryl. Now I'm going to turn around and do the same. And it was hard for me to put this together because Cheryl was amazing. But thank you again. Cheryl Dean is also a product operations manager here with Centis, living right outside of Knoxville, Tennessee. So we're basically neighbors. Cheryl has some great insight into the growth of the company over the years. She has been with the team for over 5 of those years. Actually, just had her anniversary a little bit ago, going way back to when the company was founded, doing RCM related tasks for offices. Our team did everything from posting payments to claim follow up, as well as resubmission. Prior to joining the team, Cheryl spent most of her career doing administrative and operational tasks in the dental industry. She has over 20 years of wealth and knowledge from the dental organizations. Cheryl has brought her experience and insight into the world of Zentis, allowing us to have some of the most exceptional new client training and the ability to continually expand the product development using customer insight to grow DSO efficiency and profitability. I have the pleasure of working with her every day, which has been absolutely amazing. Now, today, we plan to discuss a very exciting topic, one that surely caught my attention. What does it take to get paid in dental AR? I know it caught my attention. I know it caught your attention as well because you're all here. So thank you again for joining us today. Whether you're managing AR for one practice or 20 or hundreds, dealing with aged claims, missing deadlines is part of your daily workflow. So today is about giving our audience clarity on what's actually working, showing you ways your process can improve, and answering some questions that might be keeping you up at night. Now, if insurance AR was a simple issue and not a challenge for most dental practices, we would need to continually focus our attention in this area and continually develop solutions that can improve the process. And we know so many of us in the industry are struggling with this. We have some questions set for our team. Now, we did ask early on in the call, we did have a question we were hoping to get some feedback on from our callers. So think about this one. When tracking claims after submission, how does your practice currently process and receive this information? And how are you making sure that everything has been provided for processing? Now, let's be honest. I would say most of us, if not all of us on the call, would agree getting paid feels more like a scavenger hunt today. One where clues are missing and the clock is ticking. Right now, this is really this is the reality most practices are living in. Teams are spending hours chasing claims, manually checking portals, calling payers, and hoping for updates. There's a big visibility gap. You don't know if your claim was even received. Filing deadlines are shrinking. Some payers are down to 90 days. You miss it and the revenue's gone forever. Companies like Cigna, Emeritus, as well as United Healthcare are now reducing those filing deadlines for their in-network providers to 90 days. Payments and denials live in one system, claims live in another. So the matching of knowing what's out there and what's been paid has been a nightmare for most. And despite all of the effort, there's no clear insight in what's actually aged claims, what's recurring, and what process or what is broken and what needs to be done. Now let's look at some of these pain areas as we review some of the biggest challenges. Cheryl, what is the biggest mistake you see practices make with AR management?
Well, I think there's a few. One of them would be waiting too long to obtain that claim status. This is often, one of those tasks that just gets pushed to the side. Everybody's really busy. They're working on so many things. Patients are coming in and out, and so it's just one of those things that it kind of falls to the bottom of the list, unfortunately. Also, I think not automating the process with technology. Technology has advanced so much. And so just utilizing that to help you with that process, I think is, one of the mistakes that can be made. And then not having a dedicated team to work AR. A lot of times, like I said, it's the last thing that gets done. It gets pushed to the side, and there's not somebody specific that it's their role to make sure they're following up on those aged claims and making sure that they're being paid and making sure those initial claims are making it where they're supposed to get to.
Yeah, no, thank you so much. I would agree. I think the first one you said, waiting too long to obtain claims on status is definitely key. We have a big debate amongst our current clients that talk about, your 90-day claim processing and follow up versus your early on claim processing and follow up. We know the claim's been received and we know that the payer's processing, that payment is coming. If you waited 90 days to follow up on a claim and to check status, it's too late. You're kind of starting that process all over again. So knowing that your claim has been received by your payer is definitely number one. Technology has come a long way. We see everyone looking to automate, looking to streamline processes to make their offices more efficient, regardless of size. And like you mentioned, your team and having someone to consistently work your claims is key. However, we also know that most of our organization is client facing. So you're in the offices, you're working either with patients or with your teams, and it's hard to make sure that you have time set aside to actually work on your aged claims. Now let's look at that question. When tracking claims after submission, how does your practice confirm the claim was received and that all required information was provided for processing? And what is your current process? Well, let's take a look and see what some of our answers are.
Did anyone answer?
I say, I don't see anything.
I'm not seeing any answers.
But we do have some things that we've kind of discussed. As we know, most of us are probably doing the same thing. We look at things like having DXC as your clearinghouse. We know they do a great job with providing indicators for our offices. They at least provide information that the claim has been submitted and sometimes received if you're using some of those advanced features that are available. Looking at payer portals, I know a lot of our offices are still doing this. They're especially on some of their high value claims. They're making sure that those claims are on file and that they've been received. We also see a lot of the larger organizations using third-party vendors. They want to make sure that they're really active in utilizing and making sure that their claims have been received and are processing because they don't want to hit those 90-day deadlines. And Cheryl, please go ahead and add anything to that as well.
Yeah, well, I think too, having someone in the office that does regular follow-up, some people do have that in their process, which is great. So, I think that's good. I wanted to go back too to the dental exchange because I know, Anna, this was something that I was not aware of that you had told me is that on dental exchange, when you do the setup, you can actually set up indicators for yourself, like for specific codes that you want to say, hey, I want to make sure this claim with this code has these attachments. And I think that's something too that you can utilize in your process to be able to make sure those claims get stopped if they don't have the attachments that need to be there.
Yeah, no, you are correct. Working in the industry for so long, I know dental exchange has come a long way working with many of the PMS systems out there. They've done a phenomenal job making sure that their offices are doing their due diligence on making sure claims are going out clean and having all the necessary information based on payer guidelines. So you're able to set up indicators for your providers, your payers, your specific coding that will flag your team to make sure your periodontal charting is attached, your x-rays are attached, or any necessary documentation for that claim processing. And those claims will actually sit in the queue and until that information is received, because that payer requests that.
We do have a question there, Anna. I'm just going to interject. It says, "Is that what you are considering managing payer rules?" I'm not sure if that's what you're talking. If you're asking that question with regards to dental exchange, like what we were just mentioning, managing payer rules. I
Oh, the
think,
payer rules, because we have our specific payers ask for specific information depending on service code. So we know that some of our like surgical extractions, as an example, has become a much more frequently reviewed service code by some payers than others, similar to like anterior composites. Some payers pay those without question, others review that information. So we have guidelines, or DXC has guidelines for payers when they have seen trends or information from those payers that indicate, hey, make sure you're providing this information so that your claim is paid. And that comes directly for those individual payers or those specific payers. Now let's look at our next question. As insurance companies continue to adjust filing deadlines, what proactive steps can dental practices take to prevent denial and ensure that claims timely claim payment? Cheryl, if you can help answer some of those.
Yeah, absolutely. So first of all, I would say know the deadline. Because they are changing, it's important that this should be confirmed during eligibility checks. So assuming that you're doing eligibility checks to make sure that your patient is actually covered or their coverage hasn't changed, doing that, and then when you're on that call or getting that information, make sure you know what those deadlines are. Is it 90 days? Do you have a year? Like Anna said earlier, they're reducing those times. And so that's an important piece to know. I would also say make sure your claims are being sent the same or next day. I don't think too many of us struggle with that. I think we do get them out, but maybe the next piece of that in following through with the clearinghouse to actually make sure that it was received and that it was processed, that's a big component of that as well. So not just getting those submitted, but also following through with that clearinghouse. And then also most of our PMSs have the ability for you to run an unsubmitted claims report. And I think that's something that maybe we forget or maybe we don't utilize enough, but being able to run that report and see, are there some services that we've done that are not attached to a claim so that you can, create that claim and get those sent out.
Yeah, no, those are all good points. I think when we talk about eligibility, knowing deadlines has probably been added to your eligibility check, and as so many other questions have, because there's so many exclusions and limitations that are important to your day-to-day processing and knowing what payers will actually pay. We continue to discuss that early submission. Really important to make sure those claims are going out the door, because the sooner they're out the door, the sooner your claim payment happens. And like Cheryl mentioned, most of our practice management softwares out there have done a really great job batching claims, allowing you to run reports, or having the ability to just auto-generate claims that have been uncreated by your team during checkout processes. So make sure that you're utilizing all of these systems that are available to your teams. Now, as the dental claim payments become increasingly complex, Cheryl, can you walk us through the typical accounts receivable workflow in most practices? Where do challenges most commonly occur?
So yeah, I mean, some of us a little bit repeat, but definitely, verifying that eligibility, making sure before that patient comes in, do they have coverage? Has their coverage changed? If they're a long-standing patient, that seems to happen more frequently these days. So just making sure we know this patient is covered, and what that coverage is. making sure you're collecting the copay and the deductible at the time of service, not letting that patient walk out the door without, collecting at least that piece. As we said, submitting those claims within 24 hours and making sure they're going out clean. So I see so many denials, coming through our system of, information that was missing, critical things that we should know, perio maintenance. They always want to know what's the perio history. Make sure that's included in the claim when it goes out, goes out the door, so that you're not getting, that denial and then having to resubmit again with that information. You already have that information. Make sure it's being sent, with that claim within that 24 hours of date of service. And then again, having a good routine of reviewing those age claims, prioritizing those aging buckets, whether you, divide up your team. If you've got a couple of people, that you can have someone working the current claims, making sure those are making it to the clearinghouse and being processed, versus having someone else that's working those older aging buckets, so that you're kind of covering both ends of the spectrum there. I think that's a good workflow to have.
Yeah, no, absolutely. I would definitely agree. I think, all the things that we talk about, AR is definitely on the top of everyone's list, but verification of benefits is definitely number two. A lot of companies have done a great job streamlining that process using EDI to do electronic eligibility checks that can write back directly into your system to at least confirm that your patient indeed has coverage with a specific payer. Like Cheryl mentioned, those copays, get that money when they're at the door. Having to chase it later on down the line, it takes effort and it's revenue loss for your organizations. Submission of claims early on in the process, make sure that end of day, beginning of the next day, your attachments are done and your claims are submitted to the payers. We see some who have a extremely quick turnaround time. So if done efficiently and accurately, your claim payment can be expedited substantially. And then, like Cheryl discussed, having those buckets of things that are really important and that need to be followed up on is key. Having that team that can ensure that that is followed up on. Now, Cheryl, if you can help look at a real workflow that can provide us with within Caviar, and we can show our listeners here what our system provides. We have solutions that focus on automated status tracking, timely confirmation that claims have been received. We also provide intelligent prioritization, focus on age claims before deadlines hit, unique integration advantages where we are the only platform that is able to show our clients the payment side as well as the AR side of things and be able to match workflow automation, eliminate manual work with having to call payers because we're able to provide that on our dashboard, as well as those advanced analytics. If you can show our client callers here what we have available, that'd be wonderful.
Yeah, absolutely. Thank you. So let me share my screen and I'll just show you what we do have available with Caviar. So this is an add-on product that we have at Zentis with Remit AI. And so you can kind of see here what that's looking like. Basically, we have at the top here something that just gives you the visibility to see how many claims you have, how many open claims you have, and what's the dollar value. And then what I love for just that timely making sure things are getting sent right back out is this needs action button. So we have a partnership with Dental Exchange. If you're submitting your claims through Dental Exchange, we're able to pull that information and bring it here into the platform for you. And you can look at ones that actually need action. These are ones where you can see exactly if Dental Exchange said it's missing information or there's no claim on file, you can get those sent right back out. Your team can look at these. They can see exactly, why this was rejected. not eligible for benefits for the submitted date of service, those types of things that you need to know so that you can get those claims sent right back out and address them quickly. Another thing that I love that we have within CaviAR is that it works alongside our Remit AI platform where our payments and denials are already processed. So this saves time for your agers because now, without having to call the insurance company, and we know how time consuming that is, they can actually see right here, this payment is already matched to a denial on our Remit AI side. They can open that up. They can see their claim next to the actual payment or denial. Now they know, without having to call, that they can submit an appeal. It was denied for timely filing, or maybe it was missing information, and it will tell them what information was missing so that they can immediately address those and get those sent right back out. So again, a huge time saver. What's also great is they can see their aging buckets right up here at the top. So this also helps them to prioritize. They can see what's the dollar value, how many claims do I have sitting there, and that helps your team to be able to either split up the work or prioritize what they should be working on first. They also have the ability to use filters here to be able to drill down into specific things. If they want to look for those high dollar claims that are still sitting open, they can pull those up. They can look for specific providers. As they make notes on each claim, they can filter by the date of a note so they can stay on top of anything that they've already indicated, needs to be followed up on. They can make their notes. They can assign to a certain user within their team if they need to. They can make a resubmission, like make a note that they resubmitted this claim, when they resubmitted it, why they resubmitted it. And so this gives that digital tracking, so to speak, of what's actually happening with the claim, and they can follow what's going on. They can also, mark the claim as closed, upload an EOB, and they can even request claim status. If they need the bot to go to a portal and see what's the updated claim status, they can click on that, and it's going to give them an updated status. Even if you don't have Dental Exchange and you use Vine or some other method, this is not a blocker. We have other means of being able to get the data. And so, that's not something that hinders us. It used to, it does not anymore, thanks to, the technology that continues to advance. Let's say one of you is thinking about your own AR and maybe what questions you should be asking yourselves about your current process. I would say definitely, do I have enough people managing the process? Based on what I have open, do I have the manpower to get through these and get these worked? Are we using automation? Because that's a great way to be able to, it's a great tool to use to be able to help you through the process faster. And then do you have a system that provides clear analytics into what's taking place? Let me kind of share here. Hopefully you can still see. Can you see my analytics page? Is that showing? Okay. Great. So this is the analytics section that we have in CaviAR, and this allows you to see, kind of an overall view, what's happening, how many missing incorrect, info claims do we have? As the team is working them, how many have been closed? How many have been resubmitted or appealed? So you're able to follow and track what's happening within your organization, seeing what's been submitted on a daily basis. We give you those numbers, as well as, the dollar value of those claims that are being submitted. So you see what's potentially coming in. And then this is another piece that I love, because to me, this shows the time savings. These are the payments or the claims that are matched to payments or denials already in our system. So this is saving the user's time. All of these claims we already have details on, and the user, the ager doesn't have to call. We have a hard match and a soft match. A soft match is one where the bot says, hey, I think these two go together. We got this denial or this payment, and we think it goes with this claim. Just double check it and see if those go together. So again, saving them time and having to make calls to the insurance. And then also seeing visually those aging buckets, sometimes just having that bar graph to see which is the biggest bucket is sometimes helpful, as well as seeing, your average AR days. And then this piece is also something that I love because you want to see those claims being paid within that first 15 days. And a lot of payers will do that, sometimes even faster than 15 days. But 15 days is a good benchmark. That's when you should expect to be hearing something from the insurance payer. And so this allows you to see the first 15 days of your claims. So for each submitted date, you can see how many claims were submitted. And then as they're changing status, what percentage have changed within that first 15 days. So this is a good tracker to kind of see what's happening there. And then also being able to follow your team, what's your team doing as they're reviewing them week over week. How many have been reviewed? How many have been closed? Being able to kind of track who's outperforming, who's really being a good ager and really getting those claims looked at and resubmitted. So this is an important piece as well, to have those good analytics to be able to track and see what's going on.
Yeah, no, thank you so much for showing us that, Cheryl. We talk about what makes CAVI-AR different. Being able to see hard and soft matches to payment goes a long way. Having the ability to utilize our Remit AI system alongside CAVI-AR just work seamlessly together for their organizations. They're currently with our product and are usually day to day. We see the aging specialists have a significant time savings because they're able to, in real time, be able to match their payments that are received to potential claims that are still open within their system, and have those matches, both soft and hard. Now, Cheryl, we did have some questions here from the team. If you can take this first one from Nicole. Our partnership is through CareStack that utilizes Dental Exchange. Will we receive the same data on the Remit AI in that situation?
Yeah, you should. If you're submitting your claims through Dental Exchange, we're just pulling whatever you have submitted electronically through there. So you would have that information in CAVI-AR to show you just exactly what you submitted.
Right. And then second question was, our practice is separated by location. Are the filters customizable in Remit AI so we can filter by location? And yes, absolutely. By tax ID, by individual locations, many filters are available within our dashboard to make that workflow for your teams much easier.
Just let you know too, we really appreciate you attending today. Thank you everyone for coming. And also feel free to scan this QR code if you're interested in more information about CAVI-AR to schedule a demo. We can absolutely do that for you. That QR code will take you right to our site. So thanks everyone.